In a patient with severe preeclampsia, which medication is the first line for preventing seizures? Correct answer is option C, magnesium sulfate. A pregnant woman at 32 weeks gestation present with painless vaginal bleeding, the most likely diagnosis is? Correct answer is option B, placenta previa. Which of the following is a contraindication for the use of misoprostol in labor induction? Correct answer is option B, previous caesarean section with a classical incision. A woman with gestational diabetes mellitus is at highest risk for? Correct answer is option A, microsomia. Which fetal heart rate pattern is most concerning and requires immediate intervention? Correct answer is option C, late declarations. A pregnant woman at 28 weeks has a blood pressure of 150/100, proteinuria and severe headache. The most appropriate diagnosis is? Correct answer is option C. The most common cause of postpartum hemorrhage is? Correct answer is option B, uterine atony. A woman with polycystic ovary syndrome is at increased risk for? Correct answer is option A, type 2 diabetes mellitus. Which of the following is a sign of adequate ovulation in a woman undergoing fertility evaluation? Correct answer is option A, mid-luteal phase progesterone greater than 10. Which of the following is a risk factor for endometriosis? Correct answer is option B, nulliparity. A 24-year-old woman present with sudden severe low abdominal pain and vaginal bleeding. She has a positive pregnancy test. The most likely diagnosis is? Correct answer is option B. A woman with a BMI of 40 is at higher risk for which obstetric complication? Correct answer is option A, cesarean delivery. Which of the following is the most appropriate management for a woman with HELLP syndrome? Correct answer is option B, delivery of the fetus. A woman with a history of deep vein thrombosis is pregnant. Which anticoagulant is safest during pregnancy? Correct answer is option B, low molecular weight heparin. The most common cause of secondary amenorrhea in women of reproductive age is? Correct answer is option B, polycystic ovary syndrome. Which of the following is a key diagnostic feature of ovarian hyperstimulation syndrome? Correct answer is option A, ascites and ovarian enlargement. A woman present with a foul-smelling vaginal discharge and strawberry cervix on speculum exam, the most likely diagnosis is? Correct answer is option B. A pregnant woman at 34 weeks has a non-reassuring fetal heart racing. The next step should be? Correct answer is option B, prepare for emergency cesarean section. Which of the following is a characteristic feature of a complete hydatidiform mole? Correct answer is option B, 46XX karyotype. A woman with a history of recurrent urinary tract infection is pregnant. Which antibiotic is safe for UTI prophylaxis in pregnancy? Correct answer is option B. The most common type of gynecology cancer worldwide is. Correct answer is option B, cervical cancer. A woman with Turner syndrome is at risk for. Correct answer is option A, primary ovarian insufficiency. Which of the following is a late sign of magnesium sulfate toxicity in preeclampsia? Correct answer is option B, respiratory depression. A woman with a history of genital herpes is in labor. The best management is. Correct answer is option B, cesarean section if active lesions present. The most common cause of infertility in women is. Correct answer is option B, ovulatory dysfunction. A woman with abruption placenta is most likely to present with. Correct answer is option B, painful dark vaginal bleeding. The gold standard for diagnosing endometriosis is. Correct answer is option B, laparoscopy with biopsy. A newborn with respiratory distress, hypoglycemia, and polycythemia is most likely born to a mother with. Correct answer is option B, gestational diabetes. A woman with Asherman syndrome has. Correct answer is option A, intrauterine adhesions. The most effective long-acting reversible contraceptive method is. Correct answer is option B, intrauterine device.